با عرض سلام خدمت همه حضار محترم. این رویداد مشترک از طرف ارگان ایگل هرس و ارگان غیر دولتی سودویند در رابطه با مسئله LGBT در ایران برگزار شده و از ساعت 3:30 تا ساعت 5 ادامه داره و شما میتونید صدا رو از لاین 2 به زبان انگلیسی و از لاین 3 به زبان فارسی بشنوید و در پایان برنامه به سوال و جواب ها میپردازیم. این برنامه فیلم برداری و عکس برداری میشه. در صورتی که کسی تمایل نداره در فیلم و عکس باشه لطفاً دستشو بلند کنه و به ما اعلام کنه. اولین سخنران برنامه ما خانم روز پاریس ریکتر هستند. ایشون در رابطه با وضعیت حمایت از حقوق بشر زنان و مردان همجنسگرا، دوجنسگرا و تراجنسی در ایران صحبت می‌کنند. خانم روز دستیار ویژه گزارشگر ویژه حقوق بشر سازمان ملل متحد در خصوص ایران هستند.
The special rapporteur has undertaken 2 studies in his work. In an attempt to examine those complaints received from human rights defenders about the violation of LGBT rights in Iran. And in his reports to the Council, the Special Rapporteur has concluded that LGBT individuals struggle against the prevailing gender norms codified in law. His reports present a wide range of violations of LGBT rights that they experience over the course of their lifetimes, including restrictions on access to information, violations of rights to assemble, police harassment, arbitrary arrest, detention, torture, sexual harassment and assault, social bullying, forced marriage, and pressure to undergo gender reassignment surgeries, in addition to substandard conditions that are related to those surgeries. In about 50% of the cases reported to the Special Rapporteur, individuals experienced social bullying at school in the form of name-calling, and in about half of these cases, physical harassment was also experienced, targeting the person's gender and sexuality. In a few cases, school officials did address this behavior, but in the majority of the cases, school officials usually did nothing, effectively allowing these bullies to enjoy impunity and blaming the victim. Several interviewees also reported that while attending university, they were summoned and questioned by campus officials, and that they were suspended after discovering that they were involved in same-sex consensual relationships. The rapporteur has reported that these interviewees often express taking measures to hide their sexual orientation from their families and their surrounding communities, and that these efforts became more pronounced with age. By adolescence, and early adulthood, when individuals start to express their identity and orientation through activities, clothing, and social engagements with peers, they went to great lengths to keep their identity hidden from their families. The interviewees that report their information to the Special Rapporteur have also maintained that they've been disowned, threatened with disownership and by family members, and experienced verbal and physical abuse, all aimed at forcing them to act in accordance with social norms. Some LGBT Iranians interviewed by the Special Rapporteur report that they ran away from home, which often made them susceptible to prostitution, sexual abuse, exploitation, and violence. The Special Rapporteur has also reported that sexual otherness seems to correlate with susceptibility to rape and sexual abuse. Some 35% of interviewees in one study indicated that they were raped or sexually abused, and in many cases more than once. Of these, about 15% reported that the sexual abuse was conducted by school officials or by authorities while in detention, and others reported being abused by private actors, including family members and classmates. Family members, usually siblings or parents, typically instigated this abuse in the context of trying to force their family members to act in accordance with gender norms or to consent to marriage once they learned of the interviewee's sexual identities. Several women reported being forced to marry, and others reported that they were repeatedly raped by their husbands throughout those marriages. When asked why they didn't report this abuse to police, interviewees often maintained that being gay, lesbian, or transgender was socially unacceptable, and uniformly maintained that Therefore, reporting physical assaults would make them more susceptible to arrest and even more abuse by those authorities they complain to. In the context of rights to associate and assemble, the Special Rapporteur has received reports that government activities have severely undermined access to educational information, and that the right to associate with other members of the LGBT community have also been severely violated. LGBT Iranians report that if they become part of online forums as a way to connect with others of the same orientation or to learn about their identities, that these spaces were continuously monitored, and that security agents often infiltrated chat rooms to set up in-person meetings, which resulted in the arrest of these individuals. Reports communicate that social gatherings for LGBT Iranians are often raided by Iranian security forces, and that authorities often use physical force, including severe beatings during these raids. Individuals arrested often reported being detained for a few hours to several weeks, and some detainees report that they were charged with such crimes as organizing illegal gatherings. In a few such cases, the Special Rapporteur was told that they were severely punished for their activities, including by flogging. In his most recent report, the Special Rapporteur notes favorably that, this report was published yesterday, he reports favorably that Iranian law allows for gender persons to undergo gender confirmation surgery. Iranian law and state-sanctioned religious norms are based on a strict heterosexual female or male binary. As such, the law criminalizes homosexuality and only recognizes transsexuality. Transgender individuals can receive state permits to cross-dress on condition that they are pursuing reassignment. The process of reassignment first involves, according to reports, an individual receiving a diagnosis from a specific mental specialist, health specialist, and followed by attaining cross-dressing permits and several rounds of state-mandated group and individual counseling. After this phase, which can take several months to sometimes years, and upon certification from a mental health expert, a trans person can then receive sexual reassignment surgery. The Special Rapporteur reports, however, that information received from victims who underwent such surgeries suggests that the quality of health care they received was at times clearly substandard and not in line with the professional norms or right to adequate or attainable health care under the International Covenant for Civil and Political Rights and under the International Covenant for Economic, Social, and Cultural Rights. Interviewees claim that gender confirmation surgeries often led to serious complications, including severe bleeding, infection, scarring, chronic pain, and fistulas. Transgender Iranians also reported that their operations resulted in abnormally shaped or located sexual organs and vaginal stenosis. There are reports that licensed doctors gave these patients discounted rates for surgeries, and that ultimately deviated from standard procedures. These budgeted operations were allegedly conducted outside of operating rooms with limited anesthesia, post-operation care, and sometimes without genital reconstruction. Several transgender interviewees said that these discounted surgeries were attractive because it was difficult to access costly surgical care due to insufficient subsidies and a lengthy pre-surgery bureaucratic process. The Special Rapporteur noted that transgender persons must undergo gender confirmation operations in order to attain legal recognition of their gender in Iran, which may create an undue level of pressure to undergo such procedures. Just briefly to conclude, the Special Rapporteur recently noted that 6 decades after the Universal Declaration for Human Rights, the focus is shifting towards operationalization of human rights. However, there is little agreement on how to best advance culturally sensitive and gender-responsive methodologies for the promotion of universal human rights principles. He asserted that it is therefore imperative that we continue to advance human rights approaches grounded in the principles of universality, indivisibility, equality, participation, inclusion, and accountability, which will in turn help to encourage cultural sensitivity and gender responsiveness in our work to narrow the gap between international norms and standards and the human rights situation in countries like Iran. Thank you.